I'll take you through the numbers of cases from overnight, from yesterday. New South Wales recorded 141 locally acquired cases until 8 o'clock last night. 87 of those locally acquired cases are linked to other cases in the cluster, and 54 remain under investigation. There were no new locally overseas acquired cases in the same period. There have now been 2,081 cases associated with this outbreak since the 16th of June 2021. And a record number of over 102,000 tests were done yesterday. So thanks very much to the community for coming forward to meet this challenge. By isolation status, of the 141 cases, 65 were in isolation throughout their infectious period, and 24 for part of their infectious period. 38 were infectious while in the community. Sadly, we've been notified of 2 deaths overnight, as the Premier has mentioned. A woman in her late 30s from the Sydney CDB area has died, and a woman in her 70s from southwest Sydney has died. These are very tragic events, and our sympathies go out to their families, friends and loved ones. There are a number of people in hospital. 141 people are in hospital with COVID at present, and 43 are in intensive care, 18 of whom require ventilation. So this is a very serious disease. Of those 141, 60 are under the age of 55 and 28 under the age of 35. And of the 43 people in intensive care, 1 is in their teens, 7 are in their 20s, 3 are in their 30s, 14 are in their 50s, and 12 are in their 60s, and 6 are in their 70s. So this is affecting people of all ages with very serious disease. All but 1 are vaccinated. 1 person has just received 1 dose of vaccine. By LGA, most of the cases are in 5 LGAs. Fairfield with 34, Canterbury Bankstown with 30, Cumberland with 24, Blacktown with 19, and Liverpool with 12 cases. So we're still seeing concentration of cases in various LGAs, but cases elsewhere in the Greater Sydney area. So anybody in the Greater Sydney area is at particular risk, but we're seeing cases in these particular LGAs. We're particularly concerned for people in certain suburbs to come forward for testing with even the mildest of symptoms, and I'll just go through those areas. On the north coast of New South Wales, Coffs Harbour and Byron Bay, we've seen positive sewage in recent days in Byron Bay. In southern New South Wales, Moss Vale, again, we've seen positive sewage without a known case there. Also, Goulburn and Marulan, we're keen for people to be aware for symptoms and come forward for testing. In Western New South Wales, Orange. In Western Sydney, Cumberland, LGA, Merrylands and Guildford in particular, Toongabbie, Pendle Hill, Mount Druitt, Rooty Hill, Blacktown. In Northern Sydney, Belrose, where we've had transmission. In the inner west, Lakemba, Roselands, Punchbowl, Wiley Park, Belmore, Burwood, Campsie, particularly Tongley Supermarket, Growers Market and T&L Butchers, where we've had transmission. In southwest Sydney, of course, the Fairfield LGA, particularly Old Guildford, Liverpool LGA, particularly Hoxton Park, Carnes Hill, Voyager Point, Canterbury Bankstown, Sefton, Yagoona, Chester Hill, and in Campbelltown, particularly Bardia. In southeast Sydney, we're still worried about Georges River, Bayside, Sutherland, Waverley and Haymarket, and in Illawarra, Wollongong and Port Kembla. If you're in any of those areas, please come forward for testing with even the mildest of symptoms. It's just so important. We're concerned about a particular gathering I mentioned yesterday in Pendle Hill. This is a grieving family who came together to support each other. We know at least 50 people were at that gathering, and we've now got 28 cases associated with that gathering. So we've been working with community leaders in that area to make sure that people in that gathering are isolated and getting tested. It's so important to come forward for testing, but it's a measure of just how dangerous it is to come together from different families. Don't visit other family, don't visit other household. Don't let anyone from your extended family who doesn't live with you to come into your household. It's so important, even if you think it's just not safe to do so. I've also been notified of a person who's now in Queensland who had been on a flight while knowing that they were a close contact. So the person travelled on the 14th of July to Ballina from Sydney on Virgin Flight VA 1139 from Sydney to Ballina, arriving at around 11:45. Anybody who was on this flight is a close contact must get tested and isolated for 14 days from the date of their exposure, regardless of the result of the test. So the flight manifest we've received, and we're contacting all passengers directly. So we're aware of the person. He was tested positive on the 12th of July, following identification of a workplace exposure. He was advised he was a close contact and to isolate for 14 days regardless of the test result. We understand he got a test result which was mistakenly provided by a private lab to inform him he was negative, but this didn't change the fact that he had to isolate for 14 days. On the 20th of July, we were advised that the swab was in fact positive, and following whole genome sequencing tests, the case was immediately contacted and interviewed further that day. He stated that he had been isolating since the 10th of July. However, we know this is not true. We're believed he travelled to Queensland on July 14 and concerned about the nature and extent of his exposures on the flight and in the community, both in New South Wales and Queensland. So we're working with our colleagues in Queensland Health, and we referred the matter to the New South Wales Police. I'll leave it there. Thank you very much.